Welcome everyone, and thank you for joining us today for the webinar, Virtual Reality Hand Surgery and Therapy, a new revolutionary step. Today, we will explore how virtual reality is transforming hand surgery and therapy, offering new opportunities to improve treatment and the patient experience. We are honored to have 3 expert speakers with us, each for extensive experience in the field of hand therapy and surgery. Our first speaker will be Tom Lattrè, a physical therapist specializing in hand therapy with over 20 years of experience. Tom runs a private hand therapy practice in Ypres, Belgium, and has collaborated for many years with Warangen. It's correct pronunciation? Warangen Hospital. He has served as a president of the Belgian Hand Therapists Association and has presented his research at the Congress International. Today, he will share his work and the new frontiers that virtual reality is opening in hand therapy. Our second speaker will be Dr. Thomas Giesen, hand surgeon and consultant at SOS Mano in Lugano and Locarno, Switzerland. Finally, we will hear from Dr. Marco Guidi, a hand surgeon and consultant at the Hand Clinic in Lugano, Switzerland. Now, without further ado, let's begin with first our speaker, Tom Lattrè. So let's start, Tom.
Hello, and thank you for the introduction. I'm very grateful to the Ergomano group from Lugano to invite me here for this webinar. And I'm also very pleased and happy to join with Marco Guidi and Thomas Giesen for this evening to talk about virtual reality. Before I really start, I want to tell you a story how I started doing virtual reality. 2 years ago, we were with some friends, and my youngest son was playing with the virtual reality thing from our friends. And it was very funny for him. And after a while, he asked, Dad, can I buy myself a headset and a system from the savings for my birthday? At the beginning, that idea was for me a bit expensive because it's a quite expensive investment from his savings, but I've done some research about it, and then I asked to my friend if I could try it once, the headset for my own. And from the moment that I started going virtual, I was blown away. I was amazed about this experience, and it was me who bought the virtual reality headset, and I started to try on the patients, and I saw that it has potential for therapy. So that's the story. I'm a hand therapist for 20 years, and I'm still amazed about our hand function, about the hand anatomy, the biomechanics, and so on. We are able to put on our fancy, expensive Swiss watch on our wrists, or we can have a nice dinner with friends, a nice cheese fondue, and not trying to lose the bread into the fondue. As a therapist and the surgeons, we are trying to restore the patient's his function after a trauma, a lesion, or injury. And it is vital that we reconnect the body and the brain and the hand and the brain as soon as possible after an injury. We are all using the therapy from Ramachandran, the mirror therapy, or the graded motor imagery from Moseley. And also we have to use all the modalities of the body and senses to reconnect the brain and our hand after an injury. So how can a new technology help us to reconnect the brain and the hand after an injury? And can virtual reality help us for this? And can it be a part of a treatment? Let's find out. I will talk about immersive virtual reality in hand therapy, and is this the beginning of a new era in hand therapy? I will start from the beginning and I go step by step in the story of virtual reality. And what does virtual reality means? First of all, the word immersive. It's derived from the Latin word immersus, and it meant in the early 15th century to plunge into a fluid, and this was the context of being baptized. So you were immersed in the holy water, like this baby who was immersed in the holy water, and I believe that this baby will be afterwards a very good Christian. Now, these days, it is a state of a total absorption in a task or activity that is negatively characterized by a non-awareness of oneself, one's surroundings, and of the passing of time. So you can be immersed not only in a game or in a virtual reality, you can also be immersed when you're reading a good book or listening to good music or watching a scary movie. What does virtual mean? It comes from the Latin word virtus, and it meant then excellence, potency, and efficacy. And later on, it changed to virtualis. And from 1959, the definition is from virtual, it's not physically existing, but made to appear by software. And then what is real? And I think that the best person to explain this, what is real, that is Morpheus. Hope you can hear the audio. No audio?
What is real? Okay. How do you define real? If you're talking about what you can feel, what you can smell, what you can taste and see, then real is simply electrical signals interpreted by your brain.
Yes, and Morpheus is right. The signals, the afferent signals that we receive are by our brain processed, and that for us is real. So if you want to have 100% immersive virtual reality, then you can have the choice, or you can be plugged into the matrix, or a battery for the machines. Let's talk about the evolution of immersive virtual reality. As you can see, it has done quite of a journey. It began in the early 60s, and it was developed by the investments of the NASA, the military, the gaming industry, and the big breakthrough came by Oculus, was bought by Meta. You can see this huge machine. This is called the Sensorama, and it was invented by Morten Heiliger in the year 60. You had a machine, and you have to be aware that you could see 6 different of scenes. You could even smell the gas smoke from a passing bus. And thanks to the evolution, step by step, now we've got systems like the Apple Vision Pro that is huge performance. I think this technology will evolve very quickly. The batteries becoming smaller, the software becoming more performant, the microchips are getting better and better. And I also believe that AI will help further in the development of this technology. In this system, you've got 2 major things. You've got augmented reality and you've got virtual reality. In the first type, new things are added to your screen. So perhaps you know this guy, it's Vegeta from the anime series Dragon Ball Z. And I was a big fan of that series when I was a child. On his glasses, he could see the power of his enemies. And this system is used also in surgery, or when you're buying a new furniture of new television, you pick up your cell phone and you can drag and put and present your new television or chair in your furniture. This is also used in surgery. The surgeon put on special glasses like the HoloLens, and then he can put extra on it the visuals of the MRI scan, and so his performance as a surgeon will be better to see the structures inside. In virtual reality, everything is virtual, but it's not for gaming. You can also visit a volcano, have a conference with friends, watching a movie or a concert. Now, let's go over to the immersive virtual reality in hand therapy. Virtual reality is already used a long time in the pain clinic or during local anesthesia. The patient wears a headset and he is seeing a virtual world like this whale in the ocean. And so the patient is distracted from the pain. And on the right image, you can see Dr. Xavier Gouffier. The patient is wearing this virtual reality system while he is doing Walland surgery. And the whole thing is to distract the patients from the pain. I will use my pointer. This is a study of Hoffman, and they gave the patients or the persons a thermal pain stimuli. And on the left side, you can see the brain activity during this pain stimulus. And on the right side, the people were using a virtual reality system, and the activity in the brain was very low. So I will not talk. I use the system also in my practice. This is a patient with a severe case of Dupuytren disease. That is, the wound dressings and the mobilizations were not so pleasant for him. So in order to give him a good feeling and a moment of relaxation, I put on the virtual reality headset, and he was seeing these things. It is an application that you can become relaxed. The music is also very relaxing, and he had a good feeling about this during the wound dressings and mobilization. And this video is from today. New patient, also Dupuytren disease, surgery, open palm technique. And she asked directly if she could use the virtual reality to be distracted from the wounds and the mobilization. And she had a wonderful experience, no pain at all, and she left with a smile. So I will talk not about passive virtual reality. I will talk about the active aspect of virtual reality. I searched answers for 4 questions: how, why, who, and when. So the first question, why should we use virtual reality in our practice? Second question, for who, which patients will benefit from this kind of technology? And then when, at what moment could we really start using this? And then how? And that's for me important, how this virtual reality system works on the body and our brain. So I will respond on every of those questions this presentation. There was a study made by Pereira 4 years ago. It was a review about the application of AR and VR in hand rehab. The majority of the half was about stroke, and the rest was about after fractures, burns, tendon injuries, and so on. However, this was a study about virtual reality in 2 dimensions and not about the system VR in 3 dimensions. In January, before the Congress in France, I made research on PubMed. And if I added immersive virtual reality, I've got almost 4,000 hits. But then if I did a Boolean search and I add hand and therapy and tendon, but not stroke and not pain, I found nothing. So today, did it again, the same search words. Now already more than 4,400 hits. And then again, the same Boolean search, and I found 1 article. I was very happy, but it was my own article. So in July, I published the first experience of myself in practice about virtual reality in hand therapy. That's the basics of this presentation. So how do you do an active virtual reality in practice? You need a headset and the controllers. And with the controllers, you can also do movements with the virtual hands. If you want to press one button, then you're pinching, another button you can point, another button you can grasp. And this is a small video of my youngest son. He is making a tower with bricks, and you can see using the controllers. And now his right hand, I simulated a bandage, a small cast. So even a person with a cast after a fracture can use the controllers by simply touching the buttons of the controllers. So that's an option if they can't really move their hands fully. You can also do other things with the controllers, like basketball. And I'm here trying to make a goal with the ball. And you really need to have also a good wrist flexion to make a draw point of that exercise. And the applications in VR are big. You can golfing, do baseball, you can do yoga, boxing, and so on. So for the patients, you can choose whatever you want. But the camera of the Meta Quest 2 also contains cameras. These are infrared cameras. And with that system, there is hand tracking, and the system detects your hands, and you can do all gestures and commands with your hands. The quality of the hand tracking depends on the quality of your headset and sensors, and the quality of the software that is used. But this is advancing at high speed, so I believe that the speed and the accuracy in 3 more years, it will be much better than now. So how it works, the camera seeing your hands with infrared, and the software is splitting your hand from the background. That's called the hand detection. And then they are adding key points to your hands, the typical ones, the fingertips, the joints, the bony structures, like we all use in practice. And then they make a model-based tracking system to compute the position of the hand, the movements, and it's called an inverse kinematics model of the hand. This is used as a model for the representation in the virtual system. So, and then you get a hand in the virtual area, and they can choose whatever they like or want in the context of the application. Now you see a normal shaped hand, but it can be also like this. That is from the application called Elixir, and you can put on your hands in the magic poison, and your hands becoming green and bubbles. It's very funny. Also, you can do recording, or according to the application, special gestures to command specific things. And like in that game, if you are pointing with your fingers and then pinching, you can teleport yourself to another place. Oh, yeah. Also very funny for the kids. There was a very nice study by Abdel Karim this year. They looked to the accuracy of the hand tracking on the Meta 2 Quest. The average fingertip positional error was 1.1 centimeter. The error of the finger joint angle was almost 10 degrees, and the temporal delay was 45 milliseconds. That is fair. In my experience with the Meta 2, I have a good feeling of the accuracy. It's evolving. We're going towards top quality. We've got a Meta Quest 3 latency of 70 milliseconds, and the Apple Vision Pro has a latency of 128 milliseconds. However, important to know, latency and accuracy are 2 different things. They've got an inverse system. So if the software applicators or the hardware men are trying to improve the speed, then it can be a lower accuracy. If they want to have a better accuracy, then the speed will decrease a bit. So it depends, what do you want? I think that a sportsman loves the speed from the system, but if a surgeon would use such a system, then the accuracy would be at high performance. What is now better, hand tracking or the use of the controllers? A study by Juan and colleagues last year, they found that if you use controllers, it's better, faster and more precise. However, almost 80% of the people preferred hand tracking, and they found no difference concerning age and gender in their population. Now, the basic principle of virtual reality is the bodyship ownership illusion. So we see a virtual hand and we really believe, we think that it's our hands. And this bodyship ownership illusion is based on the rubber hand illusion. We all know the article from Botvinnik and Cohen published in Nature in '98, where a rubber hand is placed before your own hands, and you do a tactile stimulation of your real hands and the rubber hands. And after a while, if they only stimulate the rubber hands, you think you're really feel it. And this embodiment is a combination of our tactile sense, our sight, and the proprioception. Let's go a bit deeper in the sense of embodiment. There is a nice definition of Kiltini, and it is the sense that emerge when the body's properties are processed as if they were properties of one's own body. This is a bit complex material, but I'm not going to go too much in detail, but know that the sense of embodiment has three components. First of all, the sense of body ownership. And this means the existence of sufficient human likeness to presume that an artificial body can be one's body. It's a combination of the afferent information we get and our cognition. Another part is the sense of agency. So it's the sense of having a global motor control, and it's the result of two things. It's the comparison between the predicted sensory consequences and the actual sensory consequences. If it's a match, then you feel agent of the things you're doing. But important, the visuals and the motor input must be synchronized. If there is a discrepancy of more than 150 milliseconds, you don't feel agent with the system or the virtual environment. That's important. And also, there must be a sense of self-location. You must be feeling that you are inside a body. And if that's all present, you are immersed, you have a good sense of embodiment. So during hand tracking and in a virtual, it's important that also your hands are represented. However, some applications are only presenting a sphere, others are using just the controllers, others are presenting hands, and other studies and applications like this one, they are performing a task with scissors. And in the other experiment, you are showing their hands and the scissors. Some research about it told us, a study of Rika, that hand interpretation is not necessary to perform a task, but the users prefer to see their hands. Another one, they found, again, no influence on performance regarding the visuals, but if the hands were presented realistically, the people had a better experience. And the last one, the detail appearance might act as an additional component in the construction of the body ownership. So how closer to the reality, how better the embodiment, the better the immersion. And like you can see on those two images, you feel much more comfortable when you're seeing the left side, the normal hands, than the right-sided hands. They don't feel very natural. What is better now? The bodyship ownership illusion is much more stronger in an immersive 3D virtual environment compared than other 2D virtual systems. So if you want to really go for a true illusion, then you must choose certainly 3D virtual reality. It's very immersive. That is myself doing this task. I had to amputate my hands on a laser beam and they had to fall into the bowl, but I missed one. And then I was doing this like an idiot because my fingers, they were gone. So I had stumps to perform the task. So the immersion was very weird. And now I felt how a patient could be with an amputation. You are feeling, yeah, disabled. Let's talk about the reality versus the virtual world in movements. We are wearing a headset, we are seeing our hands, but how can we interact with our hands? And this interaction, is it similar in the real world than in the virtual world? Then we are acting also similar. And let's look first at the hand-eye interaction. And before we start, I'll give you some interesting side information. The human retina has got a bandwidth of 8.75 megabits for each second. The optic nerve has an average length of 4.5 centimeters. The speed of the nerve is 180 kilometers an hour. So the shortest exposure time between incoming image and then the brain is 13 milliseconds. So this system is a fast internet for us. So let's talk about the hand-eye interaction in the real world, and this with a simple pick up and drop action. So first of all, you got a visual fixation on your target. This is about half a second, then your eyes are fixed on your target. And then your fixation on the target remains until you are confident of the movement. When you're confident to pick it up, then your visual fixation will go to the next location, the drop-off location, and touch is very important. And then you're doing your movement, and again, you've got half a second visual fixation on your drop-off location. Now, there was a study from this year from Lavoie. They looked for the hand-eye interaction in virtual reality with the controllers. I didn't find an article with hand tracking, but they found that the eye behavior is quite similar in the real world versus the virtual world. The eye gaze, this is the eye tracking. The eyes are following just in time phenomena. There was a difference between the real worlds and the virtual worlds, that the task completion took twice as long as normal. And this was due to the lack of haptic feedback. So in the real world, we've got our eyes and haptic feedback. Then we've got better object recognition, better object remembering, and also a better object interaction. We've got visual feedback and haptic feedback, and therefore we are very efficient in our grasping, reaching, and manipulation of objects. We are making every second estimations of the position and the size of objects that we want to grasp, reach, or move. And the haptic feedback, it's you've got two parts of that. The finger tactility, that gives you an idea of the size of an object, and then all others, our mechanoreceptors in the muscle, the skin, and in the joints, it gives you feedback from the position of an object. But then hand tracking, there is no haptic feedback, and so you rely only on your eyes, and so your eyes are compensating for your hands. This is called the Vision for Action Information System stream. When you are doing grasping virtually, the closing phase is more uncertain because the feedback is not there, and you are moving slower with a much more opened hand to approach an object. this for us, therapy is very interesting. Your patients are moving towards an object more consciously and more slower. So that's a good part for a therapy to learn new things on. Let's talk about the prehension in the real world versus the virtual world. Is there a difference between those? You've got in the real world, if you grasp a reaching phase, grasping phase, and then you manipulate your object, but also our senses are included, and they are processed cross and multimodal in our cortex. And think about when you're picking up a fresh diaper from a baby, your prehension is totally different than when you pick up a donut or something like candy. There was a research by Furmanek and colleagues, and they found that the reach to grasp movements are largely similar in the physical world compared to the 3D immersive virtual worlds. So they made the research, they placed young persons in an infrared camera. They made some points to make an analysis of the movements, and they had to grasp spheres in the near fields, normal field, and in the far fields. And also the spheres were different in large. And they found some similarities, that the therapeutic plan did not change between those actions, and they found that the thumb and index space on grasping remained the same. They found also some differences. You've got some phases from reach to grasp. In the beginning, in the initiation phase, the real world was equal to the virtual world, but then between the shaping phase and the closure phase, there was difference. In the virtual phase, again, you were moving slower towards your objects. And because the persons were uncertain about their perception of the things they were grasping. About the EEG, they found that the EEG patterns activation during hand movement in the real world and the virtual world were largely comparable. And the use of immersive virtual reality, the brain areas with embodiment overlap, they are linked to those areas involved in the motor control. It's also an effective tool to improve motor relearning, and also there is an engagement of the brain areas believed to represent the human mirror neural system. So we've got similar hand-eye interaction. We've got a similar prehension. Our brain activity is also similar. The immersion, the body ownership illusion is also good. And then we can conclude that it's comparable for brain and the body. So it's for me a new valuable tool with potential improvements on many things. There is can be improvements on the sensory motor cortex activity. You can train the mobility, the strength, endurance, the reach to grasp movements, joint stability, also fine motor skills. You can train high-hand coordination, cognition, timing and speeding. One patient also has self-confidence, and also very important, the therapy adherence is high. The patients love virtual reality. What are the indications for myself in hand therapy? You can do an early active mobilization with virtual reality already with open wounds, patients with a fear to move after a trauma or surgery, patients with hyper and hyposensitivity. That's nice, because if you're using hand tracking, they don't feel anything. And also it's very good for patients with pain problems like CRPS or post-operative pain, and many others are perhaps to find. This is a case, it's a case, a severe case, an aversion trauma of his thumb. He had a total thumb replantation. This patient was also suffering from heavy neuropathic pain, developed CRPS, and his thumb became hypersensitive due to regeneration of the median nerve. And in this case, I used virtual reality to reconnect his brain and his body. And this is him. This is his left hand. And you can see that he is moving on a natural way, picking up these blocks. Also, he has to think about it. We have to sort the blocks on the right color. And now he's doing a strange movement. And he is just putting in a light bulb in the socket and pushing then the button to give it a light. This patient was after Dupuytren surgery 1 week post-op. In this phase, you can't use materials due to the infection hazards, but we used virtual reality. He had to sort the blocks. It's a very functional task, and there's no risk of infection, and it was a simple, funny exercise too. Next case is a patient with a traumatic crush injury of his finger, and they had to amputate the IP joint. And in this early phase, with an open wound a bit, and it was becoming hypersensitive, he could use his fingers. There's a testimony of him.
Hello, my name is Stefan.
Do you hear it?
Amputation. Index finger, left hand. After the wound allowed me, I started to do some physiotherapy. And one of the first tools that we use, let's say so, is the VR system. And I was absolutely surprised to feel things, although my finger was shorter. I was pushing buttons, I was catching balls, many other exercises, and it was like my finger was there, complete, entire, with no missing part.
So I was very happy with his testimony, and I was also very happy to hear that he had the illusion that his finger was complete. So this can act also like a kind of mirror therapy, because the system didn't see that he was missing a part of his finger. Let's move on. Virtual reality after tendon repair. This is a small application I found. It was from a small research work, and then you have to follow the different positions of bending. And this could be interesting for a patient after virtual reality, after the tendon surgery, to train the different finger positions. And the hand model is showing what you are doing, and if you are making an error, he is correcting you. That could be nice using after such a trauma. We all know Dr. Lalonde, and I met him in Val d'Isère, and he is famous for his quote, "You can move, but you can't use." And we are trying to activate our patients after tendon repair, preferable with a wall-on surgery and a strong suture. This is a patient with a crush injury of concrete. We are at this moment 3 weeks post-op. At the beginning, he was very afraid to use his hand, but then I used the virtual reality, and his movements were directly natural. At the beginning, he was pushing against myself during mobilization. When I asked to do an active mobilization, it was not so good. But then with using the virtual reality, he had more confidence, less fear to use his fingers. There is a patient with extensor repair of the index and EIP. This is 2 days after surgery, and he is switching the buttons actively. So there is directly a reconnection, a functional reconnection of his brain and hands 2 days after surgery. And he was also using the hammer, and he was punching a window to break the glass. But to be honest, I was a bit scared that moment that he would rupture again his hand by hitting the glass. So perhaps we are evolving from you can move but you can't use towards a new axioma, you can move and you can virtually use. And I made this new axioma in Val d'Isère before the presence of Don Lalande, and he was happy with it. Some remarks on virtual reality in hand therapy. Is it more a practice-based system or also a home-based system for the patients? I spoke to some people and they were from the opinion that it's a practice-based system. Next item to discuss, the cost for the patient. Buying a headset is expensive, especially if you want to have good quality, but the license for upcoming new software can also be high. So do you want to charge your patients extra for this service, technology, or not? Is this a therapy that we are doing, or is it just some funny gaming with the patients? Other question, how about progression? How do you make progression in your virtual reality training therapy? We have to think about that. And also the applications, the headsets, all the hardware and software, it's very technical, and some patients and some colleagues are not very happy to use such a system. And next item, I know that virtual reality is helping my patient, but how can we prove that? So new upcoming research, we have to think about how to prove that virtual reality is an added value for hand therapy and our treatments. Difficulty is that applications and hardware and software are rapidly evolving. So perhaps if a study is conducted, then 3 years later, there are new systems and new applications and software available. To conclude, active virtual hand therapy, it's a safe space for the patients to train. It feels realistic. Everything is possible regarding the applications that you are using, and it's fun. And it's also a method to elevate your patients' experience, and they enjoy those experiences. I just want to tell you, next year in Washington, I'm presenting a course about ultrasound-supported hand therapy, and there will be some presentation, Dr. De Kramer, about the use of virtual reality in hand therapy and also during hand surgery. So next to the following speakers, virtual reality in hand surgery. This is a small teaser. You are doing a surgery virtually, but the patients, they will survive. I thank you for your attention.
Thank you, Tom, for your amazing work. We will do the question at the end. So now I have to Thomas, if it's okay for you.
Good evening, everyone. Thank you very much, Tom. They was beyond anything. I mean, this is amazing, really. Thank you so much. The details you went in is incredible experience, and thank you very much. You are really on the front line, and you are a real pioneer in this. And
thank you.
There are no words to thank you about that. Okay, I try to share my screen. Should be this one. Okay. May I just ask if you hear me and you see me?
No.
I think Tom should stop
Yeah.
share his screen. I'm sorry.
Hello?
Tom, please, can you please stop the screen, the sharing of your screen? Sorry. Yes, thank you.
Do you see my?
Yes, crystal clear.
Okay, good. So I have to say, before starting that, let's see if it's starting at any point. Yeah, I have to say that I feel really like a baby compared to the experience of Tom. But anyway, just briefly talk about augmented reality in hand surgery. First of all, just make a difference between, I know a lot of people knows about that, but between virtual reality and augmented reality. In the virtual reality, we are completely immersed in an alternative reality and may be useful for teaching, but less for practical purpose, like in real surgery. Augmented reality is the technology that overlays digital information like pictures, labels, data into the real world. And normally it uses smart glasses, like we got the Visions from Apple as an example, but there are many of that, and headset to do that. We are used to virtual reality from the movies. And by looking this, we think this is very cool and also kind of normal because we've seen this in the movie. But in reality, the best we have is what we have in military, and basically the visors of the pilots can be used to to alert the pilot about the surroundings and probably dangers and hazards and help during the night. So basically, this is what nowadays for the best is use augmented reality. And why this could be helpful also in surgery? For three basically reasons in our view. First, for learning, so helping also the teaching for young surgeon. Second, for assisting during surgery and possibly enhancing doing that. And we go all to three things. I don't know why the videos are offset. But basically, nowadays you have some system in neurosurgery that use the virtual reality. Do you see? I don't know why this is, sorry, 1 second. I don't know why he's doing this. Condividere lo schermo. I don't know why it's off center. So basically neurosurgery, they're using navigation device to see the skeleton through the skin. I don't know if you can see this. And but what we were thinking is that these are mechanical things. You load a series of CT scan into the system and the visor, and you connect with several points on the skin. And basically, they are normally used is the 3D navigation they use in theater nowadays. But our idea was it's not actually our idea, but our efforts and to create something useful, implementing augmented reality and artificial intelligence. Why we want that? Because we want to elaborate visual information in order, as we said, to have anatomical references, anatomy function and navigation, diagnostic help, assisting the surgeon in detecting pathologies, and then for safety assist, alarm the surgeon if it's doing a mistake. So basically like piloting on an airplane. So surrounding navigation, and then assisting for landing and taking off, and then for safety reason. do this is a big work. You need to build a database of images with labels to feed the AI. So this is a big work because you have to get a surgeon, or better, a lot of surgeons, labeling manually, basically, or with little help, a lot of pictures just to name the things that they see. And then once you labeled all the pictures, you have to feed the AI in order for the AI to learn from our experience. That's what's happening nowadays with the AI. Once you've done this, you create your system, and basically a visor that is doing this stuff like recognizing anatomical structures, but then you have to validate back. It means then you have to test again what the AI learned back to the surgeon and make sure it does not make mistakes. But we create some example of what does this mean in reality. First of all, this is a little example, few seconds, of anatomy assist navigation during surgery. Use the flexor tendon after the debridement for an infection. You can see I select the layer boulates or fiber optic tissues, and the augmented reality will just label the structure by going on and just going along the structure. And this is the first example. The next goal will be diagnostic assist. It's not only naming the structure, but telling me if there is anything that's actually not, in brackets or in quotes, normal. It's the same video with the second layer. So telling me the A2 boulate is actually partially missing, and we've got the A3 boulate missing completely. So it's signaling me the damage. This is the second layer we would like to have from augmented reality during surgery. The third is a diagnosis assist with alerts of important structure around. So we got on assisting, navigating, and we are already on a safety level. As you can see, is the next step. We got the damage, but also I got the track of the radial nerve where it is between the lines and the dots where it should be. And this is very important. So we start to get alerted where important things are. And then the last layer, and this will be, of course, the best assist, pilot assist we could have during surgery, will be the same video that every time we touch something with the instruments, actually the virtual reality, the augmented reality system is telling us what are we dealing with. So in this case, it's telling me this is the FTP. In this case, the FDS. In this case, recognize again the FTP, and again here the FTP. So this is, of course, the dream. But what are the problems? And there are many problems by doing this. First of all, and we were talking before this meeting, is the hardware evolution. It's very fast. So if you develop a system, it might be obsolete in few years or in few months nowadays. Second is hardware tolerance. We'll talk about this probably later. And hardware portability, which system can anyone use it, and cost. And then, of course, the problem is the efforts for creating the database, because this kind of database that don't exist already. It's not like giving the AI the Britannica Encyclopedia. You have to create the information first. From several surgeons, you have to cross-check all the information. And this is a big effort. And there are the technical problems. First problem is, how do I activate my augmented reality during surgery? First of all, for example, is the voice activation. But this during surgery might be very disturbing, because during surgery you are talking to your assistant or your chief, you're talking to the nurse, there's an anesthesist talking, there might be the patient talking to you just because he wants to. And so these might be very disturbing, not really practical. To use the eyes, like the vision system, to activate the system during surgery can be also very challenging because, especially in hand surgery, you're looking through loops and you don't want to look around to activate stuff when you want to look on the field you're working on. Regarding the hands, you normally have the hands constantly occupied in doing something. And if you think about the feet, yeah, this might be a solution, but actually normally in hand surgery, at least if you use the pedal for the thermic, the one foot is busy, and sometimes you have the X-ray on the other one. And if you do arthroscopy, for example, you have 10 pedals. So you have also the feet quite engaged. And then how to overcome surgical loops, because you need them during hand surgery. So how do you integrate the visor into the microscope might be a solution, and kind of augmented reality is already present in some microscope, but not at the level of information we would like to have. Or we can use magnifying visors, but they have a very big problem of tolerance. This is the experience we had with the varioscope. The varioscope was a microscope that was portable, and but it had definitely a lot of problem. It never became a success. It's very heavy, and this might be also the problem of having a visor during surgery, because especially with long procedure, after a while, it might be really, really annoying to have a visor. And also the varioscope didn't really work because a lot of people like me felt sick by using it. So it's basically working in progress. I think I'm stopping now because I talked enough. Thank you.
Thank you, Thomas. Really, really interesting work. And now, Marco, are you ready?
Yes, I am. Thank you.
Thank you.
Thank you. I would like only to thank you for the invitation. And after what Tom and Thomas said, it's difficult to show you something. Of course, this is the target of this webinar is the hand therapy world. So I would like just to show you what can we do and what is a visor. This is a MetaQuest 3, so you can see it. It's something, it's the next step of the one that Tom showed in his video. Of course, this is already old, and it costs $500, so it's not super expensive, but it has a cost. And this is the evolution of the controller. I changed my mind during the presentation of my two colleagues. It was really impressive. And I would like to show you what I did during the presentation of my colleague, listening at them. And I can show you what is so the immersive reality and what can we do with virtual reality in my office right now. So especially in ultrasound. So I will share you my screen here. I hope you can see it. So this was a mirroring on my phone. So I sent the video to my Mac. So I just opened some apps. This is my room, my studio. And here I was looking for some apps. So this is what you can have. You have some tables. You can use your controller. I was just looking for some videos, and I was just right now showing you what you have to do. You have to track every single stuff that you have around you. I have some breast implants, some plates, my ultrasound machine, some bones there. And then as soon as you're done, you confirm it, and then you are inside a virtual reality room where you can use your hand or use the controller. And if you see here, you can search for something. I was a little bit in a hurry, but you can move everything. You can see your Netflix during your consultation. You can use your virtual reality to see X-ray, CT scan. And if you see, you can have all your panels here. You can move them. You can use your hand only if you leave your controller on the table. Look, this is how the system recognize the controller. But of course, you can recognize your hand. So this is an evolution of the hand recognition. And you can pinch, you can move, you can go, and you can eventually see the CT scan and do an ultrasound live. This is my Fortis machine. And so this is live. You can see this is my hand. This is very well recognized by the cameras. And then you can do live. So I want just to show you the quality of the cameras. I think they're not so perfect, but of course you can see an ultrasound. So this is recorded. So a few minutes ago, you can see the ultrasound, and this is the image of the ultrasound. So these are the cameras of the MetaQuest 3. And you can see live the movements of the hand, and this is quite interesting. Of course, don't mind to the app on the right side, but this is just what we can do. You can move, you can just place in another position, whatever you can do, it's up to you. So this is something that it's very interesting. I will stop the screen. Wait a second, because okay, and this is what we can do in a few minutes. What I want to underline that I'm developing a software right now. I'm facing some hurdles for virtual reality. The major problem that I face, and maybe this is a question for Tom and for Thomas as well, it's this motion sickness. In Italian, it's cinetosi, or it's a sickness that you can feel during the virtual reality usage, and you can feel dizzy, and you can have some trouble. You need to stop during this procedure. And I try to understand as well in the literature, of course, if you get exposed progressively, you can lower this problem. With the time, it gets better. In my experience, it doesn't. So probably it's very independent, so very subjective. I don't know if Thomas and Tom experienced this in their patients. And I think that this application has a huge chance to develop in the future. I think that right now for hand surgery, maybe Thomas will confirm this, it's still not so usable like for shoulder surgery, where you don't have loops, you don't have any microsurgical loops. But of course, the development of the technology probably in the future will help us with the voice control to have a better camera with a better magnification power, so we can do operation without loops. Of course, we need more precise camera and high-cost cameras, but the problem of dizziness and motion sickness, it will be a reality. So this is an open question for Thomas and for Tom. Maybe as you want, Tom.
Concerning the MetaQuest 2 and 3, the quality of the cameras is average. And there are, for that price, 500 euros, you get a fair to good quality. But if you buy other devices with high-end cameras, the quality is much better. So they exist, but you have to pay a price for that. The next MetaQuest 4 is for the year 26. So we have to wait 2 more years for the next evolution. I've done some research about the Apple Vision Pro and the MetaQuest 3. According to the source, some sources say that the MetaQuest 3 is better than the Apple Vision Pro and vice versa. So it's a bit what do you like or not. Regarding the cyber sickness, they call it, my patients did not have such an experience while doing these exercises, because it's mainly stationary. They are sitting or standing and doing their things. Myself, at the beginning with the virtual headset, I played the roller coaster application. Just before practice, I started in the evening, and my stomach was sick like hell for half an hour. So if you are doing many motions and up and down, you can like be on a boat, get some motion sickness, so-called cyber sickness. So it depends again on the application, and I think that young people, they can handle that. If you are already mature, it's sometimes difficult for the brain to comprehend that specific motion. Then for surgery, next step, I think that the glasses will change in the future, perhaps with a kind of helmet that you can put on. You see an augmented reality HoloLens system, very wide, and then if you don't need it again, put it back up, and then you lose your loops for the fine surgery. So things are evolving very fast, rapidly. So I think in 10 years, 20 years, yeah, this story will be old-fashioned, and yeah, we move on to next step. Thomas, what do you think?
I'm focusing on the portability, about doing this in surgery. As I know, I'm repeating myself. It's several technical issues that are quite difficult. One thing, as you say, Marco, the synetosis. I tried a headset with augmented reality in Gothenburg when I was in Sweden 2 years ago for microsurgical training. And one thing that was really striking to me, and probably, I don't know, in hand surgery, this is a matter, is the delay, especially in augmented reality. So, and if the camera is getting the movement of your hands for reproducing, there is a delay, and this delay might, at the beginning, is something like a bad song is repeating over and over again. At the beginning, you don't care. At some point, you can't stand it anymore. And this was one thing. And I'm thinking myself during microsurgery, and having a delay in any virtual or augmented reality system might be really annoying. The second thing is, I'm thinking about the visors. I don't know, but I think I tried a lot of devices. And I remember when we had the camera that was magnifying, and we tried this in Zurich, and there was a display, like a big TV, that was magnifying this. So this might be a nice setup for virtual or augmented reality, because you have a display, you see your hands, you don't look on the field, you look on the side, and you have a very, very big screen. But I'm telling you, the quality will never, ever, ever be better than real life. Now hospitals are spending 3,000, 4,000, 300,000, 400, 500,000 for a microscope, not for a visor that is a digital camera. No, we still want the clearer image. So I think, for my point of view, I'm sorry, just talking about surgery, is that the solution is what we have somehow already in the microscope. When you look inside, is telling you the luminosity and the focus is a little information written in green, and you see in your binocular. So this is very not much disturbing, and you see still reality. You can focus in, focus out. And that's why I think also the military helmet, they have very basic information. They don't have flashy stuff. They have green on gray and very simple information. And I think this might be for augmented reality in surgery. I'm talking. This might be the way to go.
Yes.
Thank you. Thank you very much. I think never say never, but I do agree with you. I think binocular, it's still right now the best solution for us. I'm looking in LinkedIn to a lot of colleagues that they are operating, but they are not hand surgeons, and they are shoulder surgeon. They did some arthroscopy, but of course for us it's still we are still at the beginning. But who knows in the future?
I have a question for Tom, if possible. May I ask you? There are. I'm pretty convinced, and I know Dr. Petrillo is listening to us. He gave me this kind of idea. I'm pretty sure that brain plasticity has a big role in the augmentation of rehabilitation through virtual reality, because we are including more senses to the injured hand. Do you know, or do you think is a study in this way feasible, like studying the activation of our brain area when you do an exercise, or when you do an exercise in virtual reality, of anything like this exists?
To my knowledge, there is no such study, but I can assume, because it's the same a bit. If virtual reality, the immersion is so big that our prehension looks normal, our brain activity is almost the same. The differences are not so big, so the response on the cortex must be also similar. So with the virtual reality, your visual sensation is maximized, but then we also have to try to stimulate our nose. You have to smell also something if you grab something. The haptics are not available in hand tracking, but they are devices that give you haptic device. Those also have vibrations. So this might be in the future a future adding point for treatment. If you're grabbing virtually something and you are going too far, like an exhortation, you feel a vibration, then you have to stop. So all those things may evolve on a fast way. However, I think that the gaming industry has no interest in therapy applications, because they don't sell so much. I think it will be up to some developers and people with some money and a good view of evolution to invest in those applications and go straight forward.
Thank you.
Sorry.
Claudio, do you want to comment?
Yes, it is a very interesting to listen to this experience. For me, I'm a physiotry. I have a lot of patients with the spasticity. We try one time with the virtuality, and the principal argument is they lost the sensibility, the vibration. So it's only for the vision, but for the neurological patient that do not have stimulation on the hand, on the body, is enough experience. So there are limited now, but I hope in the future, because it's very interesting, the modulation of the stimulation from the virtual on the brain. There are many studies, but I think in my little experience, we have to wait more to expecting a new generation of virtually glasses for the patient. I was interested to know if you have experience with the CRPS and the virtuality. what you have of patient you treat, or many patients in your clinic, Tom?
I show you that patient with the thumb replantation and CRPS, and afterwards he was happy to have that experience because he could move freely. If he touched the objects virtually, didn't provoke him pain. And patients with CRPS, we all know that the connection brain and hands is disturbed by the continuous afferent wrong information. So in the virtual reality, they see a normal hand, a virtual hand. It's not swollen, it's not glossy or hair grow. So that reconnection helps them to stabilize to that new balance. And it's also for their therapy adherence. If you add a game on the therapy, it gives them a fun experience. So they will try to move further and further on. So yes, for those patients especially, it's a nice experience and a good training. But we need studies about this. We don't really have at this moment standardized applications or protocols. Then can we make a study or an RCT? So we are just at the beginning of a new technology. I hope that in the future there will be more studies about this, and that we can prove that it's really an added value in therapy. So we have to learn, and thanks to this evening, more and more people will know about virtual reality, and perhaps some centers set up a study, a small cohort study with some patients, and doing nice things to be published in the future. Let's hope so.
Mm-hmm. And the last question is, do you have experience with spasticity? And
no, I'm only doing peripheral nerve injuries, so I don't have patients with of those kinds of problems. But literature, there is a lot of information about stroke. So in that field, you will find certainly more information.
Okay, thank you.
I'm sorry, Tom, I have a question for you. Is it possible to use VR for patients with plexopathies or those unable to use one limb? And to your knowledge, is there an app that can coherently substitute the movement of a limb?
I think if the applications that are coming up are capable to do that. So with the new software and the new interests in a virtual reality, the companies that are doing virtual rehab applications are making their applications bigger and bigger. So yes, I think for those patients also there is a future for treatments. But at this moment, I don't have knowledge of cases or studies about that.
Okay, thank you. Can you see the chat? There are 2 questions inside, or I can tell that for you.
Did you experience an improvement in old patients? How is their feedback?
Recording in progress.
What do you define as old?
Not younger, so older than boomers. If they get a good feedback.
I had different patients. I think the oldest one was around 70, and they liked it like everybody else. So I don't think that's a contraindication, the age. You just have to try it for your patients, tell them about the experience, and you are normally at the side of the patients. So if they don't feel comfortable or getting cyber sickness, you just put it away and it's over. So to my experience, there's no problem with older patients. So just try it.
Thank you. Any other question from the audience? From Mireia Esplugas.
About the applications, I'm looking around on the App Store, and if I see a nice application using hand tracking, I try it. So like the funny games for the children, the Elixir application. I'm now did a new application. It was called Surgeoneer. So it's a bit like a horror game, and you can reanimate your patients. You can give injections. It's all done by hand tracking. It's a funny game, and there are several other games that you can go on a journey and and use your hands to defeat the enemy, to make the conquest. So look around. There is lots of things that is possible, but for the therapy, I think that new applications are coming up. So in the future, perhaps you can buy therapy applications on the App Store. So we are at the beginning of a new era. So it's waiting for applications. It's waiting for better hardware, lighter hardware, because if you're wearing the headset for a while, perhaps some patients will develop neck pain. So the constructors of the headsets, they must think about lighter batteries, smaller glasses, that the weight in front for your neck is becoming lighter. Also, patients with a small face, like children, sometimes the headsets go a bit lower. They have to push up the headset or to fixate it very strongly and tight, sometimes too tight on their heads. So it will be tough for the next generations of hardware.
Thank you. Thank you.
Any more questions?
Others? No? No chat? No raising hands? Okay. Thank you, Tom. Thank you, Thomas. Thank you, Marco. It was a brilliant exposition. And thank you for all to stay till this hour. It was a great experience to share with you.
Thank you for
Thank you for the invitation.
Bye.
It was a nice evening.
You too.
Thank you. Bye.
See you later.
Thank you. Bye.
Ciao.
Bye, everyone. Thank you.